Searching up, why am I spotting before my period at 2 a.m. on Google, and then trying 5 different supplements that you saw on social media, but then still feeling completely lost is not normal, okay? Most women were never taught what spotting actually means, why it's happening, or when it's something to pay attention to. So by the end of this video, I want you to understand why you're spotting, when it's normal, and what you can do about it, and when it's time to schedule a visit, maybe with me. I'm Dr. Bala, and I've helped thousands of women get the hormone education that they should have had in their teens. I see women every single week who think spotting is random. Their doctor just shrugs, and the internet gives them 20 conflicting answers. No wonder you are overwhelmed and you are so over it, right? Because you know something's wrong with your body. Otherwise, you wouldn't be watching this video. For most women, spotting feels like your body is glitching. You're probably thinking, is something wrong with my periods? Am I pregnant? Did I just ruin my cycle again? What is going on in here? And it's really frustrating. And every Google search just sends you into that deeper panic. And your doctor has always told you it's normal that you're spotting if you have a period. But I am here to tell you it is not. And here's what it means. Because the chances are, along with your spotting, you're likely having PMS symptoms, mood swings, hot flashes, skin issues, bloating, gut issues, sleep issues, right? So it's definitely not fun and it's definitely not normal. It's a clue and your body's way of whispering to you that something is going on with your hormones and your uterus and your periods. So let's decode it. The timing of spotting is going to matter a lot. So make sure that you're tracking your cycles because it's really important when you're spotting. So mid-cycle spotting is usually an estrogen dip around ovulation. So as we ovulate, our estrogen gets really high and then comes down really low. And for some women, that can cause a little bit of spotting. So that's telling us we need to work on that estrogen metabolism mid-cycle. Now, spotting that happens before your period is often because of low progesterone or a short luteal phase, also because of low progesterone. Your uterine lining starts breaking down a little bit too early because there's not enough progesterone to hold it all together. So if you are spotting for 1 day, 3 days, a whole week before your period starts, that is telling me that we need to work on your progesterone levels. And that can be done with stress regulation. That can be done with nutrient timing. That can be done with blood sugar regulation. There are different herbs that we can consider. It really just depends on what's going on in your body. And we'll look at labs and other things to evaluate that. The third type of spotting we're going to be paying attention to is spotting after sex. That might be a cervical issue or inflammation because the cervix is really sensitive and vascular. So if there's irritation or an infection, you're going to see that show up after intercourse. And then the last spotting that we are going to be paying attention to is going to be random spotting that shows up in between cycles. So sometimes that's structural. It could be because you have polyps or fibroids that are causing extra bleeding in between your cycles. And one thing that women get wrong all the time is that spotting after your period is not actually spotting unless your period actually stopped for several days and then it starts up again with more spotting. That trickling at the end of your bleeding is actually just oxidized blood. It is just the rest of your period coming out a little bit more slowly than the other more heavy bleeding part of your cycle. So when blood gets exposed to oxygen or it's in our vaginal canal a little bit longer, it turns brown and it's just coming out a little bit slower. So even if you stop bleeding for 24 hours and then have that trickling brown blood at the very end of your period, that is normal. And we just need to work a little bit on circulation. So doing things like dry brushing, pelvic dry brushing in particular, things like castor oil packs, lymphatic massages, all of those can help to maybe bring your period to a point where it starts with bright red bleeding. There's no brown blood at the end or even at the beginning. So if that is brown blood is something that you're noticing, that tells us it's a circulation issue. So let's work on that. Another very common question I get is, what is day 1 of my cycle? When do I start tracking that? I have heard that it should be when I see any level of bleeding. So even when I'm spotting, and then other people have heard when their full period starts. When is day 1? So here is how we're going to clear that up. Day 1 is the first day that you see bright red bleeding that you need a full period product for. So if you don't need a pad, if you don't need a tampon, if you're just noticing some blood when you're wiping, or you're just seeing a little bit of tiny drops in your underwear, that is not your period, that is spotting. So I still want you to track how many days you see that and when in your cycle you're at with that, because remember, that gives us clues as to what's going on. However, day 1 of your cycle, day 1 of your period is when you have bright red bleeding. So if you are nodding along thinking, okay, this is literally me, this is what I've been told told. I've been Googling all these things, feeling so confused about my body. You don't need another supplement that you saw on social media. You just need someone who can actually decode your cycle and help you understand what your body is telling you. That's exactly what I do with my clients and my patients. So if you are ready to stop chat GPTing at 2 a.m. and start getting real answers, then I want you to use the link below and let's figure out your spotting together. Because your body isn't broken, it's just communicating. And once you learn the language, everything changes. You will have more confidence in your body and you will stop having to feel anxious and Googling every little symptom that you hear about. So like and subscribe for more period health information.